Symptoms of vitamin B12 deficiency. Vitamin B12, also known as cobalamin, is a water-soluble vitamin important for the normal functioning of the brain and nervous system. It is often recommended for vegans because it can be difficult to get enough from the diet. The need for vitamin B12 varies from person to person. For instance, people who have a stomach infection, diabetes, and those who drink too much alcohol require more of this vitamin. Vitamin B12 is an essential nutrient that is found in certain animal-based foods, such as meat and poultry, or in fortified foods, such as breakfast cereals and soy milk. In this video, we're going to discuss the most common symptoms of vitamin B12 deficiency. But before we begin, as always, let me remind you that this video is intended solely for educational and entertainment purposes, and you should always consult your doctor before changing your diet or taking any new foods or supplements. If you like this video, don't forget to give it a thumb up and consider subscribing to our channel to receive future videos with more helpful advice and tips. Number 1. Fatigue. Vitamin B12 deficiency can lead to several symptoms, including fatigue. If you're experiencing a lack of energy and feeling tired, it may be time to get tested for vitamin deficiencies. Vitamin B12 deficiency can lead to a variety of ailments ranging from anemia and fatigue to neurological and psychiatric disorders. It is caused by either a poor diet or malabsorption of the vitamin. One of the most common causes is pernicious anemia, which is due to an autoimmune disorder that destroys the cells that produce intrinsic factors, which aids in B12 absorption. Number 2. Tingling hands or feet. Because vitamin B12 is essential to the nervous system, deficient levels may cause one to experience pins and needles in their hands or feet. Without this particular vitamin, it's possible that one could experience nerve conduction problems or nerve damage. B12 helps produce myelin, which is like a protective coating that wraps around the nerves and ensures reliable transmission of sensations. People with a vitamin B12 deficiency may experience nerve damage. Without adequate myelin coating, this can lead to degeneration of tissue and eventual malfunctioning of the nerves. Nerve problems are more common in the hands and feet, which are called peripheral nerves. They may lead to tingling sensations in these parts of the body. Number 3. Movement problems. If you have peripheral nerve damage caused by vitamin B12 deficiency, it can make it difficult to perform daily tasks and movements. It may take time for these symptoms to manifest themselves. Numbness in your feet and legs can make it difficult or impossible to walk without help. Other symptoms may be muscle weakness, diminished reflexes, or burning sensations in the feet. Number 4. Pale skin. Pale or yellow skin or jaundice can be a symptom if you are vitamin B12 deficient. When a person's body fails to manufacture enough red blood cells, they may develop jaundice. Typically, red blood cells circulate under the skin and give it its normal color. If the number is lower, the skin may turn pale. Vitamin B12 is needed for the production of red blood cells. If a person lacks it, they can develop megaloblastic anemia and experience symptoms such as jaundice. This type of anemia means your red blood cells are weaker and used up more quickly. It's the liver that breaks down the red blood cells, releasing a brownish substance called bilirubin that makes the skin have a yellowish tone. Number 5. Fast heart rate. Vitamin B12 deficiency can cause a rapid heart rate. The heart will typically beat faster to compensate for the decreased production of red blood cells. This will lead to an increased pulse rate, which can be sensed throughout the body. Anemia puts more pressure on the heart, causing it to pump blood around the body faster. This is the body's response to try and ensure that enough oxygen circulates through your entire system and reaches all of your organs. Number 6. Breathing problems. Anemia due to a vitamin B12 deficiency may cause you to feel short of breath. It is also possible that this might be the result of fewer red blood cells and a faster heartbeat. If you are having difficulties breathing, it is important to go see a doctor. Number 7. Glossitis and mouth ulcers. Glossitis is an inflammation of the tongue. If you have glossitis, your tongue noticeably changes shape and color. This often makes your tongue sore and swollen. Your tongue structure can sometimes change when it becomes inflamed. The bumps on your tongue, known as filiform papillae, which contain your taste buds, may stretch out and disappear over time. Glossitis can be both uncomfortable and inconvenient. It makes eating and speaking more difficult and changes your entire lifestyle. Swelling and redness within the tongue can be an early sign of vitamin B12 deficiency if there are long, white lesions present. If you're deficient in B12, it's also possible for you to experience other oral symptoms, such as mouth ulcers, feeling needles or pins on the tongue, and a burning and itching sensation in the mouth. Number 8. Disturbed vision. Another symptom of B12 deficiency is blurry or distorted vision. This can happen when an untreated B12 deficiency results in damage to the optic nerve, which eventually leads to optic atrophy. Damage to the nervous tissues leading from your eye to your brain can disrupt the message being relayed to the brain, which leads to vision impairment. This is called optic neuropathy. Although alarming, low B12 levels are often reversible by supplementing. Number 9. Mood changes. People who are B12 deficient often experience changes in their mood. Recent research has linked low levels of vitamin B12 to mood problems, cognitive impairment, and depression. The homocysteine hypothesis of depression is one potential explanation for why there might be a link between vitamin B12 and depression. It has been suggested that high levels of homocysteine caused by low levels of B12 may cause brain damage, interfering with the brain's ability to transmit messages. Signs and symptoms may be mood changes. Some studies suggest that in people with vitamin B12 deficiencies, supplementing with the vitamin can reverse these symptoms. Many factors affect mood and conditions like dementia and depression. So far, there have been inconclusive results about how supplements might help. There are proven medical therapies for depression and dementia. However, sometimes people think that supplements can replace these other treatments. The reality is that they can help improve one's mood, but not to the same extent as the more established medical treatments. Number 10. Nausea, vomiting, and diarrhea. Vitamin B12 deficiency can lead to problems with the digestive tract. It is important to mention that a lack of red blood cells can lead to insufficient oxygen. This can cause people both to feel and be sick, as well as possible instances of diarrhea. People with vitamin B12 deficiency are often unable to produce enough stomach acid needed to digest food. This can lead to nausea, which can place an individual at risk for loss of appetite. A decreased appetite may lead to weight loss in the long term. The best sources of vitamin B12 for most people are obtained from a standard diet. If you can't get enough from your usual intake, fortified food and dietary supplements might provide the needed supply. I hope you enjoyed the video, and if you'd want to help us produce more like it, please subscribe to the channel and turn on the bell to get any future videos with more useful health-related tips and information.